Welcome, everyone. I'd like to thank you for joining us today for what we hope will be an informative and engaging discussion. The challenge of will calls is one that we hear repeatedly from our clients across the NEMT industry. Every provider and every broker has their unique ways of trying to minimize the impact of call returns, their unpredictability, and their destabilizing effect on scheduling resources. Some methods are more effective than others, so it's really great that our guests can provide multiple points of view for us today. For those of you who don't recognize me, this is Gail Bowes. I'm speaking to you as the new industry consultant for NEMT for TripSpark Technologies. From First Transit, we have General Manager Corey Walter. And from Cape Cod Regional Transit Authority, we have Deputy Administrator and HST Coordinator Paula George. Let's begin with Paula. Paula, can you tell us a bit about your operation and who you serve?
Yes, Gail. Good afternoon, everyone. The Cape Cod Regional Transit Authority, we're the human service transportation broker, and we have a contract with the state of Massachusetts to provide not only non-emergency medical transportation, but also program-based transportation as well. We operate on average about 120 non-emergency medical transportation vehicles daily. And our service area is over 400 square miles of beautiful Cape Cod, along with both islands of Martha's Vineyard and Nantucket. We have 15 transportation providers, including our own dial-a-ride transportation service, and trips are assigned to them based on the lowest cost and availability. We provided 304,675 trips in FY15, and of those, 122,155 were actually non-emergency transportation service.
You certainly serve a gorgeous area of the country. That picture makes me want to go swimming.
It's beautiful.
Paula, on average, how many will calls might Cape Cod have been dealing with in the past?
Well, our policy here is that we do not allow will calls. We require our HST consumers to give us a return time and instruct them if that time changes to notify us as soon as possible. It's estimated that on average, we only have about 15% that call and change their return time. Now, our transportation providers understand that return times may change, and they need to be prepared to pick up the consumer within 30 minutes of the requested return time. And if they're unable to provide the requested return time, they need to call us immediately, and we'll arrange for another transportation provider to pick up the consumer.
How much time do you think was invested in dealing with will calls?
Well, according to our call center supervisor, he tells me that it takes obviously several minutes to change the return time and to notify the transportation provider. But then the transportation provider needs to notify the driver, and in some cases move the trip to another driver or bus to accommodate the change.
Gotcha. Well, then tell us, what did you decide to do about that?
Well, many of our medical appointments are predicated by the time that the service is provided. For example, the dialysis appointments takes approximately 4 hours, and are scheduled usually at 6:15, 11:15, and sometimes there's afternoon appointments as well. And then our methadone treatments, we bring our methadone consumers, we have 15, an 8:15, and a 9:15 times. This makes the return times the same as those consumers who are receiving treatment at those facilities, so that we can group them together with the same appointment time and the same return time.
And have you found that this has reduced the incidence of difficulties with will calls?
Well, yes, because we give them their return time. Because in the case of methadone, we run dedicated methadone buses so that we will group those consumers together, and then the bus will wait until everyone's received their dose, and then everyone is taken home, and we do that. Now, this does reduce the times for those consumers who have subscriptions to those facilities who provide services at the certain times of the day, like our methadone and also our dialysis. And then we have others as well for mental health facilities as well. The consumers go in at 9 and they come out at 3.
So it seems like the more information that you have about a client's trip details, the better you can adjust should something unexpected arise. For example, it might help, or it seems like it helps to gather information about the reason for each trip, so the type of each trip, like you mentioned the methadone or mental health in order to be able to book that trip with a predictable return time so that you don't actually have to have it scheduled as a will call. You might also find that having clients phone or text in can allow you to update things more quickly should they change their pickup time. Paul, have you encouraged your clients, or how have you encouraged your clients to provide more accurate information about their trip?
Well, the consumer information is downloaded into our systems on a nightly basis from MassHealth. And this is confirmed each time the consumer calls to schedule their rides. Our call takers have a script that they follow to ensure that we have all of the consumer's correct information. But in addition to that, we also have program information in terms of when the program start times and end times. But usually that information comes through on their prescription for transit.
Okay. Well, thank you. Corey, let's move on to you. First Transit has had similarly innovative approaches and seen some good results as well. Could you tell us a little bit more about First Transit, your operation, who you serve, and how this affects and in your case, both the NEMT broker as well as provider?
Yes, First Transit currently serves as a broker for about 15 transportation providers in the Portland metro area. We also are the broker for a regional CCO in Yamhill County, Oregon. And we also serve as a provider with our Safe Ride program. So I've been able to see this situation from two different perspectives on a pretty regular basis. I think that one thing I would like to say
Corey,
is that
for those of us who aren't familiar with the term CCO, maybe you could explain that to our listeners.
A CCO stands for Community Care Organization. You might have heard of MCO in your past for Managed Care Organization, and I think that those terms are fairly similar and can be intertwined. A CCO is responsible for managing the care of Medicaid clients in their region, and that includes transportation, as well as physical health, mental health, dental, vision, pharmacy, etc. It's new to the state of Oregon. Within the last year or so, the state changed the model for how Medicaid is delivered to clients, and therefore changed our transportation model as well. I think that one thing I would say is that in 21 years of working in NEMT brokering specifically, my recollection is that call returns were the preferred standard in the beginning of time. And as people started to experience long waits when they would call for their return, that changed over time, and people were far more interested in timed returns. And when I say people, I mean both clients and the medical industry, as well as we as an organization recognized that timed returns are better from all perspectives. It's interesting to me that over time I saw clients even become savvy enough to say, talk it out in building in 15 extra minutes for the unknown. So even though they knew their doctor was saying the appointment's for 30 minutes, they were savvy enough to say, but let's make it 45 because you never know. And oftentimes that really does work. The success of that is proven in a large metropolitan area where we were very successful at being able to get people picked up in a really timely manner using the timed return. From a transportation provider point of view, I can tell you that the timed return is much easier to manage. You know what to expect. You can make plans for your driver to be available at that time. With call returns, it's just a big unknown and can result in poor on-time performance overall, conflicts. You can't be two places at once, and that's a proven fact. So oftentimes what ends up happening is the transportation provider calls up the broker and says, I'm sorry, but I can't do this ride. And we all know that that leads to even longer waits while the broker then tries to scramble to find a new provider to service that order. So obviously the call return has some far-reaching effects overall.
And do you have contract standards now with regard to how long folks can wait or are expected to wait if they have a call return?
Yes, for a call return, someone should expect to wait anywhere from 45 to 60 minutes. and sometimes, honestly, longer. Even though the contract indicates it must be within 60 minutes, there are times when traffic and other factors just don't make that possible.
Yeah, I was just thinking that at rush hour in cities in particular, it would seem like that might be very difficult if it was a call return to be able to first have sufficient resources available, but also to be able to mitigate those traffic issues and meet those standards. Would you think that then a kind of a scheduled return would allow providers to be more timely and therefore you as a broker also be able to better meet your standards?
Yes, I would definitely agree with that. When it's hard to believe from a broker point of view, sometimes that the transportation provider just really has no one available, but I've actually seen it firsthand where the call return comes in and all of our wheelchair van drivers are on one side of the city and the call return is on the other side of the city, 16 miles away, and it's a busy traffic time. Not only does your transportation provider have to finish up what they're doing right now, but then they have to get to the person who's waiting. So the timed return allows transportation providers and brokers to know what to expect and make allowances for that, to have that planned out in advance. And it's much more likely that a person is picked up than in a timely manner.
So over time, you said, Corey, that kind of in the beginning of the industry, will calls were kind of standard, and I recall that from my early days as well. Have over time then you, in your organization, kind of changed your policies or your procedures to try to schedule more timed returns? Have you done that? Has that been a success for you?
Yes, that we have done that, and it is successful. I think that the whole organization, from both the broker perspective as well as the medical field, prefers the timed return at this point in our lineage as an industry. And we've encouraged the timed return. We're not in a position to force a timed return at this time contractually, but we encourage the timed return. We ask questions to the client about, well, how long do you think that will be? Or when we know that there's a set time, as what Paula was referring to with dialysis, for example, or another good example is mental health appointments are almost always an hour for a one-on-one mental health session or a group session. And so we can make some assumptions together with the client as to what is a good time for the pickup return, and it's much more successful overall.
Do you find then that your clients are pretty agreeable when you're trying to set them up with a call return, or do you have to, how do you work with them to encourage them to do that?
I think most times people are agreeable to the time to return, especially when we explain for a call return it can take up to 1 hour for someone to get to you. Then people are usually pretty happy to offer a time. I think what makes people uncomfortable is they just don't know. Well, I'm going to this appointment, and I have no idea how long it's going to last, or I'm seeing multiple doctors at that location today, and that doctor always runs late, and I just don't know. And then we have to, in our particular case, we have to accept that call return in that situation. Or what we can do is encourage the client, hey, you know what, call us when you think you're going to be finished. If you find out it is going to be a certain time, let us know. And then we can schedule the transportation provider to be there at that time. That works really well in small systems. That's a little harder in larger systems.
Sure. Yeah, if the volume is too large, then that kind of fills your call center with additional calls.
Yes.
I have a couple more questions for each of you. And Corey, maybe since you're speaking right now, you can start. How has technology influenced your operation? Do you have any technology tools that you use that have assisted with this, or that you think could assist with the issue of will calls?
The technology tools that we have currently allow us to make changes faster, allow us to communicate with our provider field in a more efficient way than having to pick up the phone and call necessarily. We've also seen great success in using timed returns so that we can share more rides. And technology plays a part in that piece of our business as well. If you have call returns, you can't predict and therefore can't share. But if you have timed returns, then you can share rides more effectively, and with the technology that you have, make better schedules for your transportation providers. And in my opinion, scheduling is the hub that turns the wheel, so to speak, no pun intended, of a transportation system. When you have good schedules, you have good outcomes. That's an area that has to be focused on in order to have success for you and for your transportation providers. Call returns can definitely influence the provider's success overall and have farther-reaching effects. When you're trying to create these successful schedules by utilizing your great technology that you have nowadays to make those things work, it's really pretty interesting to see how far we've come in terms of the technology that we have that can produce better outcomes overall and create communication options between us and our provider community quicker and more efficiently.
Yes, for those of us who've been in the industry for many years, we really have seen significant changes and improvements that allow us to be able to deal with large systems much more effectively than we could in years past. Paula, maybe you can then tell us how, in your organization, how you think that technology has influenced your ability to handle will calls efficiently.
Like Corey, too, we have the technology so that we're able to also share rides because we can do a matching when we're batching our trips each day for the next day. And being able to give a provider a return window. I mean, they understand that can change, and sometimes it does, and they need to be prepared to be able to provide that ride back. But then also, too, the faster we know and understand about cancellations, the faster we can prevent no-show events, and then also, in many cases, our technology allows us to cancel a ride and inform the transportation providers before they actually dispatch a vehicle. So I think that, our technology has helped us in many ways to be able to manage the non-emergency transportation that we provide in a much more efficient and cost-effective way. Because like with Corey, we too look at ride share whenever possible and encourage our providers that if they see something that we did not see, to also share those rides.
That's interesting, the connection with shared rides. I hadn't thought about that before we spoke today, but that's very true. If you can schedule those return trips in advance and know the pickup times, then you're right. You can actually increase the number of shared rides because you have some consistency that you can then build into your scheduling. Paula, you mentioned the word no-shows, and I know we had a conversation a little bit earlier about kind of no-shows and their connection with will calls. I was wondering if you and Corey would share some of your thoughts on that.
Yeah, our no-shows obviously are just a cost of doing business. You're always going to have some consumers, for whatever reason, are unable to be there when their ride arrives. And so how we manage our no-shows here is that our service, because it's part of the CCRTA way that we do business, is we're a door-to-door service. So our providers are required, if they get to the consumer's home and they're not readily available, that they need to go to the door or to call them. And they need to inform us when someone has no-showed them. And what we do is that we report whatever no-shows that we get to the agency. But more importantly, what we do is we try to connect with the consumer to let them know that they were a no-show. And if they have a subscription with us and they are and they seem to no-show more than they should, then what we do is we make them call in the day before for their next day trips. And then we have our providers call them out before they actually dispatch a vehicle. Now, if they call them out and they do not get an answer, then we require them to dispatch that vehicle out there to make sure that it could be the person was in the restroom or there was some reason why they didn't answer. And so what we tell our providers is this, is that you're going to have no-shows. That's just, and you need to reflect that in your provider rates to us because it really is a cost of doing business. And I can understand that the agencies we provide services for will not suspend consumers for no-show because this is medical transportation and they do need to get to the services that they're being transported to.
Corey?
I would agree with everything that Paula had to say there about no-shows and how they influence our industry. I'm trying to make a connection between will calls and no-shows, but I think that I'm finding more of a connection actually in time returns and no-shows. I think that one of the challenges in our industry is that someone says they're going to be ready at a specific time. Our driver shows up on that time, and lo and behold, the doctor is not finished with them for whatever reason. I think that it's fair to say that the client doesn't have any control over the doctor's office. So in this case, the driver leaves, and then we have to duplicate our work in order to have another transportation provider sent when they do then call for their return ride. So no-shows on a return are very specific. I think no-shows at home are a little bit different animal. No-shows at home are purely, usually anyway, the client's choice, if you will. I'm thinking about clients who have to go to the hospital unexpectedly and don't think to call to cancel their transportation. But where you have routine riders, for example, who are chronic no-show problems, that seems to be a choice, and that is difficult to manage within our systems, and it creates unnecessary delays for other people. If folks didn't no-show, then we could be more efficient with our scheduling, and transportation providers would be able to be more successful in completing their schedule for the day. They could be somewhere else instead of at the place where they're getting a no-show, of course.
A question that came to mind as both of you were talking is, so individuals have, or riders have now completed their appointment and they're calling for their return ride, and it's been set up as a will call. A couple things. Do you find that there are very many, and this is the connection with no-shows, do you find that there are very many no-shows when someone has actually called for their will call, other than, Corey, as what you were saying, when the doctor really isn't done?
Mm-hmm.
Because I was wondering if folks are calling for a will call and you're saying it could be 60 minutes, for example, to get to them, are you or your providers finding that individuals are no longer there? They're not waiting for you for that 60 minutes, and then you show up or your provider shows up and now you have a no-show?
Yes, that definitely happens, especially if the member client has some resource available to them, or public transportation is nearby the medical facility. Sometimes folks will choose not to wait. Or a friend or family member becomes available, they're able to come pick them up. People who don't have any other options for transportation, who truly cannot use public transportation, for example, will inevitably wait. But yes, there are definitely times when a call return is made and the provider goes out for the client and they are simply not there any longer, or they've disappeared and moved on somewhere else and you have to try to track them down.
In your service?
Yeah, we've had that happen as well, that, they had to call to change their time because their doctor was running late or so forth, and we had to have the provider go at a different time. And however, our providers are required to pick them up within 30 minutes of their requested return time. And when they pick them up later than that, then although sometimes it happens because it's just a matter of when they have a vehicle available. But but that does happen with us as well.
And do either of you, once you have received that will call request to come and pick them up, I'm now finished with my appointment and I now need to be picked up, do either of your organizations make a return call to confirm that? Or do you just, or because sometimes individuals will call, you'll then have to assign it to a provider or a vehicle. And in that time frame, things might have changed. So I'm just wondering if you have a practice or a policy where once you receive that will call request, if your provider or that vehicle can then contact the rider to, again, confirm that they do still need ride, where specifically they will be, or does that just kind of end with the call center, the call to the call center?
In my experience, it ends with the call center. When the client calls for their return, the call center should be asking the question, where will you be waiting? And then passing that information on to the transportation provider, letting them know that the person is ready to go and they'll be waiting at the main entrance, for example. And there shouldn't be the need to then contact back to the client to confirm that they're really truly ready to go, or that, what would be nice, of course, is if there was some technology option where the driver could let the client know via a text message or something, I'll be there, I'm on the way, or I'm on this street or whatnot. That's my perfect world scenario, of course.
It would be nice to be able to have that driver have that sense of that, yes, when I show up, I'm going to drive all this way. Yes, when I show up, there will actually be somebody there. So if, 5 minutes before or something, they would be able to do that.
Once we notify our transportation providers, what they're instructed to do is that they need to reach out to that consumer to let them know what an estimated time of arrival is if they're not able to go immediately. So if they know they're going to be at least 30 minutes out, then they need to call them and just let them know, look, this is around our estimated time of arrival to pick you up. So they could wait inside until they're ready to, the provider's there to pick them up.
I think that one experience also to share is that many times when clients are calling in to complain, or they're calling to check on the status of their ride and they're angry about it because they've been waiting, that most of that is about anticipation and anxiety over not knowing. So if there is a way to let people know this is how long we think it will be, or if there were a way in future, technology-wise, for transportation providers to be able to directly communicate with that person, then I think that helps to alleviate that particular tension and stress on the individual, which has a positive, far-reaching effect for the whole system.
Yeah, I would agree. Sometimes the unknown makes one uneasy and change your behavior. So having that kind of confidence could really make a difference. Is there anything in particular that either of you would like to kind of wrap up our conversation here? We talked a little bit about kind of strategies for reducing the problems that come along with will calls by gathering additional information and trying to get as much of that up front as possible so that we can build timed returns into our schedule, and the possibility of potentially having that technology available to be able to have the drivers actually communicate with the riders to make sure that they have, between the two of them, they have greater confidence that my ride will show up and my rider will be there when I show up. Paula, is there anything that you'd like to add as kind of a wrap-up to our conversation today?
Sure. I'd like to say that the network of transportation providers that we have do an outstanding job. The number of complaints that we get in a month is just so minimal, so small. And most times it's kind of an on-time performance thing. We very rarely have a missed trip. We very rarely have complaints from passengers about our providers, because I do believe they do go to the extra mile to be sure that that they're there when they're supposed to be there. If the consumer's not there, they make every effort to reach out to them, because actually, it's just good business to be able to do that. So I think I'm very fortunate because the number of complaints that we get are just so minimal. And we follow up on them. We get back to our consumers. I reach out to the providers, and when appropriate, I fine them for lateness. I fine them if there's a mistrip. So I just think that I'm sure Cora will speak to her providers, but our people just do a great job. And I guess I know that a lot of it has to do with the technology that we have available, and then how we're able to communicate with our providers and able to communicate to our consumers as well.
Thank you, Paula. In the meantime, while you were speaking, we have a question that popped up, and it's actually for you, Corey. This is a question from one of our listeners, Jennifer. How do you manage timed returns for methadone clients in particular? Corey, as a manager for medical transportation, you experienced firsthand how difficult that can be. Do you have any information or thoughts about managing that?
How to manage timed returns for methadone? Well, in my experience, the majority of methadone trips are actually wait and returns, where the client is going in, they're dosing, and then they're finished, and the transportation provider shall stand by and then take them right back home. And there are two really big reasons for that. One is the methadone clinics in our area specifically do not appreciate people loitering. They want the client to come in and out and be gone. So in an effort to be good partners, we agreed to provide transportation in that manner. For as far as time returns are concerned, for methadone clients in particular, if there's a time return that's scheduled, then every effort is made, of course, to get there at that time or to try to manipulate other people's schedules to meet up with that time return so that we can share rides. The difficulty that may be alluded to here is in an effort to try to really coordinate some sharing opportunities where you have clients who are going to and from the same exact clinic and they're coming from the same neighborhoods, and trying to sort of institute a mandatory time frame to do shared rides. And the difficulty that we ran into was the ever-changing schedule for the methadone client. Our methadone treatment centers here in Portland are pretty fluid in their groups and other mental health appointments or in their requests for urinalysis for clients. And they sort of made their schedules like, well, you can come on Tuesday or Thursday as long as you come to group. And there was no set schedules. So in trying to sort of mandate people going at the same times in order to create that shared experience like Paula's talked about, where you have the bus leaving at certain times and that's the time you go or you don't go, we ran into really big difficulties with the methadone clinics themselves in the way that they operate their business. It was just sort of a counterproductive to the way that they wanted to provide the service to their clientele. So that became impossible to manage, quite frankly. I think that's all I have to say about that.
Okay, good deal. Was there anything else that you would like to add to kind of wrap up our conversation about will calls today?
Not really. I think that we've covered everything, and just appreciate the opportunity to be able to participate in this production today. Very exciting to be a speaker on the panel, so to speak. And I've enjoyed talking about it with everyone, and I think that this will be a conversation until the end of time.
I think you're right there. Well, I want to thank both you, Corey, and you, Paula, for your time today and your expertise in sharing it with our audience. And for our audience, I'd like to encourage those of you who are listening to visit the websites of our two speakers today to learn more about their operations. Also, we only got one question today, but if you have other questions, do feel free to email it to us at tripspark.com, and we'll respond to you individually. And you can also, and we would love this, if you would contact us and let us know if you have any suggestions for future webinar topics. We'd be glad to set those up and gather some more great speakers. One other thing before I let you go, if you do want further information about things that we have put together already with regard to non-emergency medical transportation, we have a number of white papers and other documents that might be good references for you. If you want to go ahead and check the tripspark.com website and then click on Medical, you'll see there is a link to Resources and Learning Center, and we have a number of items listed in there with regard to NEMT. Just so that it's easy, all of them are highlighted in blue. So if you see blue, that means it's non-emergency medical transportation. Just a couple of them that we have up right now are better ways NEMT companies can coordinate return rides for clients. And then another one that we did recently was trends that NEMT providers need to know. We regularly update the website and add new content docs. So if you have a chance and want to check it out, please feel free to do so. Again, thank you very much to Paula, and thank you very much to Corey for being with us today, and hope you enjoyed this and found it beneficial.